welcome to this episode of the NLN podcast, Nursing Edge Unscripted. I am the host of today's episode, Raquel Bertiz, and with me co-hosting is Dr. Kellie Bryant, and we are from the National League for Nursing. And today we are excited to have with us Dr. Lisa Seldomridge. She is a professor at Salisbury University. She is the director of the PAMI, and I will have her to spell that out and talk to you about it. And our conversation for today is a very interesting one, and we are going to go into conversations of faculty mentoring and, of course, the ongoing nursing workforce shortage that has affected not just Maryland, but the entire country. So welcome, Lisa.
Thank you so much. I'm happy to be here.
So let's go ahead and dive right into this interesting conversation. Really just kind of explore what is going on with nursing workforce shortage and faculty mentoring. So if you could share with us your current initiative of faculty mentoring and tell us how that all started and where are you at this point?
Okay, well, I am at Salisbury University in Maryland, and we are located on a peninsula called the Eastern Shore of Maryland. And even though people may not think of us as being somewhat isolated and rural, we have the Chesapeake Bay between us and Baltimore-Washington corridor. And we have for over a decade been experiencing a shortage in nursing faculty, and in particular, clinical faculty, individuals who are interested in some kind of part-time teaching initiative, gig, we call it. And so this initiative, the Faculty Academy and Mentorship Initiative of Maryland, which we call FAMI, MD, actually began in 2011 as a collaboration between our university, a local community college, and a historically Black college and university. And it was very much centered around how we could work together to meet our own needs for clinical faculty. We were finding actually that we were sharing people across the employment setting. And we also were noticing that the folks who were expert clinicians who really had in their heart a desire to teach needed some more skills, and they needed more knowledge, and they needed support. And we thought, you know, we can do this together. And that's really how it began. 2011, we wrote a grant proposal to the Maryland Higher Education Commission. They have a program called the Nurse Support 2 program, and we received a 4-year grant to get our program started. And I'll stop there for a second. I don't know if you have another particular question or I should keep rolling on because there's been a lot of water under the bridge since 2011.
No, I think you should continue. Tell us some of the components of this it's called FAMI. I want to make sure I'm pronouncing it correctly. Tell us some of the components. What do your learners, what do they receive in this program?
Yeah, so thanks for that's a great question. So when we started the program, our plan was to design a curriculum and deliver that through teaching teams or facilitator teams that represented each of those three entities. We really wanted sort of a blended, we didn't want it to be the Salisbury version, or in that time it was Sojourner Douglas College was our partner. So we had representatives from each of the three, and we were calling ourselves facilitators because we wanted to establish this collegial environment where we were welcoming these expert nurses into the fold, you know, as new educators and as colleagues. So in those days, we were not as skilled at delivering things online. And so we actually were meeting in person and developed this curriculum, which was really designed to give people kind of I don't know, sort of a broad brush, a bird's eye view of some of the things that they might need to know to be successful. Things like, curriculum designs and what were the differences between our 3 programs. And remember, we were doing this very much in a self-serving way. And, what was the difference in terms of program outcomes versus course outcomes. And in some cases, we had clinical outcomes and then we had theory course outcomes. So how do all those things, align? We talked about accreditation, the difference in accreditation standards, the different professional standards that we use to guide our programs. And then we really rolled up our sleeves and got into, I think, sort of probably for our learners, more interesting things like, what are the legal aspects that you need to consider? How do you set expectations for your students in terms of, your response time to them, or, expectations for contacting you if for some reason they couldn't come to a clinical experience? How do you even set up a clinical experience? How do you identify patient care experiences? And we were also trying to be mindful of, having meaning across clinical settings. So not just for a hospital based. How do you keep track of your 8 or 10 students, when you may have, rank novices who need quite a bit of your attention? What's the difference between how you teach people effectively in the cognitive domain versus the psychomotor domain versus affective domain? How do you foster critical thinking in a clinical setting? And I could go on and on. Mm-hmm. But we wanted to give people, very practical information. And, as I said, kind of create a community where we weren't putting ourselves up on pedestals as experts, but we were there to all learn from one another. So then time rolled on, and the first grant came to a close. We were extremely successful. And the Maryland Higher Education Commission came back to us and said, this model seems to really be working well for you. Would you be interested in writing a continuation grant and taking it across the state? And we said, of course we are. So then that's exactly what we did. Again, we were still in a face-to-face delivery for most. We had some online learning activities that the participants would do in between our meeting times. We would meet about every 2 weeks. And we also wanted to be mindful of the fact that these were working professionals. They were doing this training on, kind of their own time around their regular work schedule. So we had, I believe at that time we had 3 face-to-face meetings, and we essentially took our show on the road. So we had a location on the Eastern Shore of Maryland. We had a location more centrally in Baltimore, and then we had another location out in Western Maryland. A couple of things just to add to that. So we began integrating simulations. I know, Raquel, you would love that, because part of what we wanted to do was give our participants an opportunity to work through in real time some of the kinds of situations they might find themselves in, have an opportunity to get some peer feedback, and have an opportunity to have a do-over, to kind of reconsider maybe an approach. And so we did that kind of thing using, trained actors, and then use different simulation facilities around the state. The other thing just that I skipped over in the beginning, but I did want to just go back to, is we really had 4 main objectives, and those objectives have continued over this 14-year period that we've been running this. The number 1, of course, was to increase the number of faculty who were available for open positions in the state, and by providing this training. Number two was we wanted to increase the number of trained individuals from underrepresented groups, because we looked around and we said, we have not made enough progress in terms of diversity of our faculty workforce. Our students are getting more diverse, but we are not. And so we want to be much more intentional about that. We were interested in prioritizing the training to help us staff particular clinical areas where we were all struggling. Not surprisingly, it was OB, peds, psych, mental health. Those were our top. And then our other sort of not so secret mission was to encourage folks who had completed our program to advance their education, either through advanced certifications or advanced degrees. Again, just trying to have a better prepared, better educated faculty workforce. So
yeah, and I was actually very curious earlier when you said that you were very successful and you were actually offered by the Higher Education Commission to have a continuation grant. And after hearing you kind of like enumerate your goals, right? Or your like apparent and hidden intent. So I'm curious at this point, like 14 years fast forward. So I'm curious to see, like, are you filling faculty positions in your area or in the state? Have you seen an increase in diversity of our faculty population or the clinical educators and all that? So what's the current picture of I would say all these goals and what you have achieved?
Yeah, thank you. Great question. So we to date have 650 graduates. 73% of them have taken some kind of teaching assignment for, and this is part of what I'm most proud of. I mean, 3/4 of them are helping fill the positions, and our graduates are working at every single nursing program in the state of Maryland. So what started as, a very local thing to meet our own needs has now really expanded the pool of available faculty to meet the needs across the state. 43% of our graduates come from underrepresented groups. And so that for us is defined as racial and ethnic minorities and men. And about 1/3 of them come from those high need clinical specialties that I mentioned before. So that's the picture to date, and we're keep on raising the bar for ourselves.
Right, and that sounds really wonderful, and that is a challenge that Maryland, not only Maryland encounters, but I think, of course, all across the board. So I also heard you say, well, we've been using simulation methodologies to educate the educators. And yeah, of course, we love that, right? Kellie and I,
we love everything simulation.
Right. So anything that has something to do with simulations, because we know it's a very powerful learning methodology. So if our educators experience it firsthand, so hopefully they can get buy-in into using that as well in their teaching. So other than simulations, what current delivery modalities have you been using to kind of like impart what our future educators or even current educators need as far as competencies are concerned? So I heard simulations, so I heard face-to-face, but currently, how are you programming your instructional design is pretty much what I'm curious about.
Yeah, so, this is one of those things that actually the pandemic helped us with a lot. We needed, of course, to pivot to distance delivery of the FAMI program during the pandemic. And that actually created a wonderful opportunity for us that instead of, as I said, taking our show on the road, we transitioned everything to hybrid learning. So we had some online modules, which were, I wouldn't call them self-study. They were, people go through this program as a cohort. So we take between 10 and 15 people at a time. They're committing to a 6-week period. And during that 6-week period, there are online modules and a variety of things that, you might expect. So, case studies and discussion boards and, various kinds of assignments. And then we come together about every 2 weeks for Zoom meetings. And those sessions are, I guess, fairly intense. We do ask people for about a 4-hour time block. And that's our time to build community. That's the way in which, we're delivering our simulations. We, of course, were, immersed during the pandemic in terms of, well, how can we make clinical type experiences happen when, we weren't often able to even be in clinical agencies. And so, all the kinds of things that we did, during the pandemic got introduced into our curriculum as other kinds of learning strategies. So those, have remained. And that model of 6 weeks time, it's 40 contact hours, about 2 weeks to do the online and engage with your colleagues, come together, have our sessions, which are, again, focused conversations around topics, simulations, and then ending up with what we call our sort of mentoring night, which is setting the stage for like what's next. So our participants, because we have continued to be grant funded, we are able to pay them an honorarium for their time. It's $1,000. And, on the one hand, that sounds like a lot. On the other hand, we're asking a lot from them. And so, they're free to use that to support childcare or, work a little less during this intense course. And then they also receive 40 CEs through the Maryland Nurses Association. So, yeah.
Oh, sorry for talking over.
That's okay.
I was like, wow, that's a unique feature of the FAMI, because anywhere else you go where you would need faculty development, there is a cost associated with it, and yours is the reverse. They receive stipend or allowance, or I don't know how you call it, for participating in the academy activities, right? So my question then is, given that these nurses are busy individuals, and that the course is really intense, from what I hear you say, an intense period of time with all of these activities, how do you enhance engagement and participation? So I'm curious, like, do they do you have dropout rates, or how's your retention rate and all that? Yeah. And so after all of these things, what's going on? Yeah.
So that's a really good question. I don't have a hard and fast retention rate to report, but I would say that I believe our completion rate is extremely high. And part of that is that there is an application process. We are in the fortunate position that we have more applicants than we are able to take. We have, again, very intentionally limited the size of each of the academies. We run 10 or 11 of them a year because we want there to be a close connection. We don't want this to be a MOOC. We really want this for people to feel bonded with the others that they're in this program with. And so in our application process, and then also in our kind of initial, I call it the course launch, we go through, I mean, everybody gets the schedule, actually that's posted online, with kind of, this is what you can expect you'll have to spend every week, so that people have an idea. I will say that life has happened along the way to folks, and we've maybe had to have some flexibility with deadlines. So much is around peer-to-peer learning, though, is if you get too far out of step, with what the rest of your colleagues are working on, it could be a better choice to say, why don't you step away right now and come back? We're going to be offering another one in a few more weeks, and come back when life has settled a little bit. Because I think the main thing we want people to love teaching. We want them to bring, not just their expertise, but their excitement about preparing our next generation of nurses. And so we don't, we just want to really have a supportive community for our new folks.
So, Lisa, this is such a wonderful program and is much needed. Raquel and I were just having this conversation the other day that a lot of us get into teaching coming from clinical practice and then getting our first job in academia. And as we know, whether we're a nurse practitioner or we're coming from the clinical setting, it doesn't prepare us to be an educator. NP school doesn't teach us how to create syllabus, how to create test questions, how to put a curriculum together. So that's why I think it's so important that we have more of these type of faculty mentorship programs, particularly for people who do not have a background in nursing education. So my question is, you have great outcomes. This has been a very successful program. Have you had any thoughts about ways that we can scale this program so it can be duplicated in other cities or states, or has it been already done in other states?
Yeah, so great question, because every time, of course, you write a grant, they want to know sustainability and scalability.
Mm-hmm. Exactly.
Yeah, no, it's a terrific question. So kind of interestingly enough, when we very first started, of course, we scoured the internet because we thought certainly there must be something out there already that we can build upon. And we actually did find a wonderful curriculum that was put together as it's the Mid-Health Alliance of Kansas City, and it was a collaboration between a couple schools of nursing and a large medical center there. Their curriculum was available for purchase and was very reasonable, and so we purchased that. But we also realized that there were some things that we would like to add to their curriculum. So had conversations with them about making adaptations, and they were very willing to, to allow that to happen. And that's how we integrated the simulations. We expanded some of the sections. Over the years, our participants had told us, well, this 40 contact hour thing is great, but we want more. And so we actually wrote another grant to MHEC to develop an advanced curriculum, because there wasn't anything, or we didn't see anything quite like that. So we developed that ourselves, which is another 40 contact hour workshop, same arrangement, $1,000 honorarium. In exchange for those, which I don't think I said, and I do need to say this, is our participants do need to agree to have their contact information be in our database that is then shared with the deans and directors or hiring managers for the schools, so that if they get a phone call out of the blue, they kind of come to expect that. So in terms of scalability, I think the main thing is how to get the word out about not just this program, but, and I know that there's a conversation going on in the NLN community, gosh, I've forgotten what the name of that is, about somebody is working on, I think it's a capstone project, and they're trying to build a curriculum like this for clinical faculty. We don't all have to reinvent the wheel. And I mean, frankly, one of the things I think could be terrific is if the grant funding came to an end and if the grantors were okay with, we'd have to think about intellectual property and all those kinds of things, is creating something that could be available kind of on a national level. Back to Raquel's point, I don't know that I think it would have to be, a fee for service kind of, that we probably wouldn't be in a position to compensate people for taking this, but rather, making it available. But, even just recently here at NERC, just several days ago, there are lots of presentations around what we need. And so anyway, we've tried to put the word out, but we appreciate the opportunity to share through this podcast and love to talk with folks about how to collaborate and how to do this, in a bigger way for all of us.
Mm-hmm. So yeah, definitely very interesting conversation we're having right now. And I know 20-minute discussion
Goes too quick.
is never enough, but we would definitely share the word out there through this podcast, all the information about FAMI and your other projects.
That would be absolutely wonderful. We need to just continue to share really good ideas. And again, I'm so grateful for the opportunity to be with you today.
Thanks.
Yes, thank you also for taking this time to have this very important conversation. So before we close, and so if you could just identify at least like one nugget of information that you would like to share with the nursing education community about faculty mentoring.
Oh, just one.
That's right.
Just one. I think it is about the power of collaboration. And part of why this program, I believe, is successful is that we have facilitators representing a lot of schools across Maryland, and that same model could be replicated. We don't often think about putting together teaching teams across institutions, and that's a really interesting way, particularly around preparing clinical faculty, many of whom do teach for different schools. So this whole idea of, let's share what we know, share, kind of what we've learned, maybe Kellie, you said before, kind of through trial and error, is that people who come behind us don't have to, go through those same challenging times. Yeah.
Yes, definitely. Collaboration is the key in many things. So thank you for joining us for this episode of Nursing Edge Unscripted. Thank you, Dr. Lisa Seldomridge. And thank you for sharing your insights and expertise with us today. So we appreciate your support, and we look forward to continuing the conversation in our next episode. So thank you very much.
Bye-bye.
Very welcome.
Thank you.
Bye-bye.